Welcome, folks, to another episode of Exposed Vet Productions. My name is John. They call me Jay Besser. I'm the host of this show. Today I have, well, let's do the date. Today is the first day of May, 2025. It's a little rainy day, but it's pretty cool here in Kentucky. Got my co-host, Mr. Ray Cobb. How you doing, Ray?
I'm doing great. How are you on this May Day? Did you get out and
Oh,
play
we're
with the May
doing
Day
great.
pole?
No, no, no. I don't do things like that. It's to me, it's not playing Mayday. It's called hobble around the pole. You know. We got a treat for you guys. We got a young lady that's quite regular on the show, and we're going to have a big discussion tonight on certain types of denials that you receive from the VA. We uh, thought all week trying to find a nice, fancy name for this show, and we finally figured it out. This is Bethany Spangenberg. She is the owner, CEO, and the HMFIC of Valor for Vet. And that's the Highly Mobile Foley Instructor's Chair.
Oh my gosh. Took you a minute to come up with that acronym.
Yeah. How you doing, girl?
I'm good. I'm
Uh,
actually really excited because my seedlings are sprouting and we've got lots of rain, and I'm hoping that this summer we're not getting a big drought, and hopefully I can have a beautiful garden. So today's a good day.
That's right. Get them Missouri Wonders grows, you'll be fine. If you like green beans.
Mm,
Ooh, stick
got all
beans.
kinds of stuff.
Okay, that's awesome.
So,
But no, we were going to touch on these denials, and I guess we've been compiling some stuff, and we've discussed a few of them, in the process of setting up the show. And I think you got a couple of good ones there that the listeners need to listen to because some of the stuff is, it's like, I don't know, they're on Mars or something. I have no idea what they're doing. I don't think they
yeah,
do either, tell you in a lot of cases.
yeah, it's actually pretty surprising to see some of the verbiage in the rating decisions. And, doing what we do on a regular basis, we see a lot of rating decisions. And we want to see those so then that way we can kind of refute, um, what their medical expert is saying versus, what we have in our report. So we see a lot of medical opinions. We see a lot of denial letters. Um, One thing too, with me being a former compensation and pension examiner, I pick up on a lot of verbiage that is basically copied and pasted from examiner to examiner. And I know what that's like to receive an email from your regional office to say, hey, use this verbiage. And basically, every examiner is copying, pasting that into their denial opinion. And so every case that I have here today, it's hopefully a learning lesson, something that can teach veterans, veteran advocates, and um, use some of my frustration into a useful education moment, I guess. So, but I've got a whole stack of them, and I kind of was just going to like randomly pick one because hopefully we can get through them all. But there's quite a bit.
Mm,
So, and I'd like to hear some stories from you guys as well, because it always, telling the stories helps other veterans to kind of, compare
mm-hmm,
themselves to other veterans. So,
mm.
all right. 1, 2, 3, 4, 5, 6. I have 6 right here. John, give me a number. 1 through 6.
So my favorite number is, no, let's not do that one. Let's do three.
3. 1, 2, 3. All right. So 1, 2, 3, 4, 5. Yeah, I have 6. I thought I had more than that. Um, so this is a case that we worked on that we received, and this is a rating decision dated March 28th of 2024. So a little over a year ago. And this veteran was applying for sleep apnea. And this rating decision says that their previous denial for service connection was um, confirmed and continued. So, in the details of, and if you have a rating decision with you and you want to kind of follow along as we do some of these, I highly encourage that because there's certain sections of the rating decision that as a medical examiner we like to look at. And when we look at the rating decision, we first start with the dates of service that are recognized by the VA because medical examiners don't go through each DD 214 to verify when your service was. We're relying on the VA to give that information to us. So That's the first thing we look at is the dates of service. And when we jump down to why the veteran was denied for their service connection, the VA put, "We requested a medical opinion of the new evidence submitted with your supplemental claim. The conditions of sleep apnea and post-traumatic stress disorder are not medically related. The obstructive sleep apnea is a separate entity entirely from the post-traumatic stress disorder and unrelated to it. A thorough review of medical literature failed to demonstrate a causal relationship. A nexus has not been established." And it's interesting that we started with this one because when I was at the VA and I was a compensation and pension examiner, we would receive emails of verbiage to add into the comments section of our report. And sometimes it would be because new case law came out, but sometimes in hindsight, it was to circumvent the rating schedule. And this verbiage, if you've been denied for sleep apnea, you've probably seen this same verbiage in your denial letter. Because when they say that sleep apnea is a separate entity entirely from fill in the blank and unrelated to it, a thorough review of medical literature failed to demonstrate a causal relationship, that is all copied and pasted. And believe it or not, this was not intentional, but another rating decision that I have to discuss tonight has the same verbiage and it's completely different areas of the country. So that should be a flag whenever you look at your rating decision, you see that verbiage in there. So if we jump down to the bottom section where they quote the medical examiner's opinion further, the medical examiner talks about what sleep apnea is, and then it says, quote, "The most common cause of sleep apnea in adults is obesity, being a male, and advanced age." Okay, that was the reason why they denied this veteran. Now, there's no reference to medical literature associated with this. There is no discussion about the veteran's individual case. And then the second opinion that was issued was that there was not a link found between the sleep apnea and the known toxic exposures, including but not limited to the veterans' deployments to Kuwait. A nexus has not been established. So that's another pattern that we're seeing. They're throwing everything against a toxic exposure related activity or a TERA. And a lot of times the veterans aren't even claiming that way. So that's an easy way for them to say a denial. So if we actually look at the veteran's history, remember there's three things that why the veteran was denied that the medical examiner said. They said, well, the risk factors are obesity, being a male, and advancing age. So then we pull up the veteran's history, and he had a sleep study done in July of 2019. At the time of his diagnosis, he was 42 years old, which is not a risk factor for sleep apnea. And his body mass index was 27, which is not a risk factor for sleep apnea. So the only risk factor that the CMP examiner identified that was correct was that he was a male. And so when we wrote the nexus letter, we said in July of 2019, when he had this study, the only conditions that he was known to have and diagnosed with was PTSD, vitamin D deficiency. Those are the only two things. So then we have to break down, okay, why has this veteran who is not obese, who is not advancing age, why did he develop sleep apnea? And so for this one, we decided that the evidence suggested that his sleep apnea was secondary to his PTSD. And in the bottom section of our Nexus letters, this is where I have the most fun, is because I open up and I just kind of hammer out like everything that was incorrect. And so I put on there, the veteran was previously denied service connection. A previous CMP examiner provided a negative opinion stating that obesity, being male, and older age are the most common causes of sleep apnea in adults. However, This veteran does not fit the profile as he is neither obese nor of advanced age. The medical opinion lacks a discussion on this veteran's specific medical conditions and the risk factors related to sleep apnea. So when you put the medical opinions side by side, ours has more probative value, and we're just arguing that, the
Having a little
VA
technical difficulty,
opinion
folks. Can
was
you hear me right?
inadequate. It's insufficient. It's
I
not
can hear
accurate.
you,
It's not
yeah. I
looking at
can't
this
hear
Yeah.
veteran's
Bethany. She's
conditions.
kind of
And
frozen or locked up.
I think she's frozen and locked up.
you cut out a
And
little bit, or is it me cutting out?
hmm, let me get it straightened out. But there she is. It's lagging a little bit. Can you hear it, Bethany?
I see that. Yeah, I can hear you now. Am
Okay.
I
Well,
lagging?
you want to try? Okay. It's you kind of um, it's lagging a little bit, and every once in a while it frees you up. I don't know if it's a plug-in problem or something like that. 'Cause I know you got fast enough internet, so sometimes it does that. We're still sit on 720. Oh, okay. We have folks been talking about this denials and some of the crazy stuff they come up with. Like you don't really. I mean, you have to have some type of medical nexus or information,
Okay,
and
let's
you have
try
to
that
let
again.
them. Okay, there you go. I just explained to folks that if you have a denial letter like that and they give you your reasons for your denial, they have to give you a basis and a reason for the denial. And saying you're fat and go diet then is not a reason for a denial, basically, right?
Yeah, and that medical opinion didn't discuss specifically that veteran and what the veteran's risk
Hmm.
factors were. So they were pulling all these risk factors out of thin air, but none of them applied to the veteran. So in that case, there's the only way that, in my opinion, when you're looking at seeking help from legal side or from a medical side, in my opinion, the best avenue is to get a medical opinion in that instance.
Bethany, I have a question for you. When I went through my sleep apnea claims and everything, at that time, um, in the VA, the only medical condition that they recognized that would cause sleep apnea, and in the sleep apnea clinic at Vanderbilt, what they would state would cause it, beside the ones that you just mentioned, was a heart condition. And your your heart condition is a part, if you look, according to the American Heart Association. Now, I haven't looked at it in several years because, I won my case. So, but back, I'm going to say 2011, 2012, that the American Heart Association conceded that sleep apnea is a direct result of a heart condition. So, therefore, if you had the diagnosis of ischemic heart disease, which I did have, and in my case, I'd had open heart surgery with 3 blockages and a double bypass, they granted mine real quick. I actually, in my records when I did my claim, in my letter, I stated very clearly that it was secondary to my ischemic heart disease. I didn't give them a chance to look anywhere else. And I also quoted in that letter that the American Heart Association, on a given date, had declared that sleep apnea is the direct result of a heart condition or some form of a heart disorder. So I'm not for sure that with what you were trying to do there, if there really is any medical, that would be my question. What medical evidence is there that combines the two, the sleep apnea, to the medical condition? Is there any test? Is there any evidence beside that garbage that they cut and paste all the time. And I've seen the same thing. Matter of fact, they'll use almost the same verbiage in diabetics. Age and weight and all of that as being a diabetic, not the fact that you were sprayed with Agent Orange. But is there some direct result from what you were working on and had that denial
So
medical community?
yeah, so there's a lot of literature out there now. When I first started doing this, when I first transitioned away from the VA into doing more of the accreditation education, doing my continuing legal education, I first did not believe that there was a relationship between sleep apnea and PTSD or mental health conditions in general. When I went to a NOVA conference, National Organization of Veteran Advocates, there was I always do this. There was an individual there as a representative from the VA who was medical, and he stood in front of 300 attorneys and said, there is literature out there that connects PTSD and sleep apnea. And that was like 2017, 2018. And so at that point, I was like, I really got to understand this thought process and what that means. And so I started digging into the literature. Well, now that there's more data out, there is signals in the brain waves. So when you do an in-lab sleep study and they capture the brain waves, they say that the REM sleep disruption is a significant sign for those with PTSD. And they say it's like not the gold standard, but it's the flag of having some type of mental health disorder, anxiety, or PTSD is when the REM sleep cycles are disrupted. The other part is for sleep apnea, and a lot of medical teaching is segmented. They talk about the the endocrine organs, or they'll transition to just the cardiology organs and functions and just the lungs, but they never really talk about how those systems communicate and intertwine. So when it comes to mental health and it comes to insomnia, it comes to diseases or mental health issues that cause sleep fragmentation, what happens is that sleep fragmentation doesn't allow the quality of sleep that you need. So you're changing in and out of these sleep cycles more rapidly in order for your body to kind of catch up. And I personally I have data that captures how much REM that I get, how my latency, how long it takes me to fall asleep. I look at my movement. So I have personally looked at my own data for the last year to really understand my own body. And that has contributed to my understanding of mental health conditions and sleep apnea. The other literature that's out there talks about how musculoskeletal conditions can contribute to sleep fragmentation because of the pain. And if their pain is not well controlled, then they are having the sleep fragmentation as well. Then there's research out there that talks about the medications that are used to treat certain ailments, that those medications are preventing an individual to cycle through the different sleep stages, and it's causing during certain sleep stages is when your body starts to relax and you're not getting the good open airway that you normally would. So when you're disrupting your normal sleep cycle, you actually have more laxity in the back of your throat and your body is not as responsive. So if you're choking or gasping for air, you're in a deeper sleep before your body starts to respond. So deeper sleep, lower oxygen, and then your body finally arouses. So there's a lot out there now, but like I said, to start with, I was not sold. I was not bought. I didn't buy into it.
But you had to make your own decision and your own, you had to look at it and kind of make your own mind up. That's a good, that's a good, shows good character doing that.
There's also research out there too on the VA website. that talks about PTSD and sleep apnea and the relationship between the two. So for the C&P examiners to say that they're two separate conditions in entirety and there's no relationship, they're failing to look at the literature that's out there. And the VA has literature out there on their website that says it's education for the veterans with PTSD that they should be undergoing a sleep study because of the relationship between PTSD and sleep apnea. And we use that in our reports as well.
Yeah. Is there any, I mean, say for example, from a VA rating purpose for the situation, if you're rated for sleep apnea, I think it's listed in the Title 38, Part 4 under the, is it still under the lungs, respiratory? Or did they separate it out?
Yeah.
Okay.
There's a lot of
If
research
you,
out there about upper sinusitis
mhm,
causing sleep apnea too. That's a
mhm,
lot that we're seeing now because sinusitis rhinitis being presumptive. And when it comes to the rhinitis, what we're seeing is a lot of veterans are getting kind of a delayed diagnosis. So they may have been may have been diagnosed with sleep apnea 10 years ago, and they're just now getting the diagnosis of sinusitis and rhinitis. And when we look at those
mhm,
cases, we really have to look at that veteran's history in and understand what factors are playing a role in the sleep apnea. Because if
mhm,
they have other primary factors, then we can't write the nexus for sinusitis causing sleep apnea.
mhm, mhm.
So hopefully
You know,
that,
Ray was in the talk about heart disease. I mean, I know there's a lot of folks that have sleep apnea that have atrial fibrillation, and they have the strokes that are triggered by AFib. You know, if you blood clots their brain, they wind up passing away because of that. And most of the root cause is sleep apnea because it triggered your AFib to take effect, and you fired a clot in your history.
yes,
So that's only in another world. Maybe down in Tennessee they'll get it because nobody here is going to get that service connected.
that's actually part of the workup in the clinic. If somebody has AFib, then we work them up for sleep
Hmm.
apnea because the sleep apnea can cause the AFib,
Hmm. Or you make it worse too, though, if you had it
or
for a long
vice
time.
versa too.
Yeah. So, but it's, I mean, for rating, I mean, if you're already 100% for lung disease, it really wouldn't matter, would it?
No,
Because they'd put you on the pyramid, try to push you up the top.
I've seen some of those trying to say like, well, they'll rate over sleep apnea over asthma. And from I talked to an attorney about this before. So if you're a veteran out there that's getting one rating decision for both asthma and sleep apnea, you need to argue that because when I talked to the attorney about it, what they said is there's a difference because in the regulations there's a comma that separates the two versus a dash. So in the legal jargon that I've learned, there's a difference between a comma and a dash. So
and
you should
or
be getting
and
rating decisions for both.
Mhm. Well, get me out of my misery. All right, all you advocates and all you agents listening to this, get at the table and stack your balls up, and get ready to break because
Mm.
we got a game to play.
Yeah.
All because of a comma. Good idea.
So I'd like
Good
to go
boy.
ahead and move on to the next one.
Mm. Okay.
This is also about sleep apnea. Am I cutting out again or am I doing all right?
No, you're fine. You're rolling pretty good now.
All right, good. So for this veteran, um, let's see here. Okay, I got them together. I knew I had more than six. Anyways, okay. So this veteran was denied for obstructive sleep apnea, and he was seeking a service connection through obesity. Okay, so there is
Mm.
an obesity as an intermediate step, which you can't get service connected for obesity, but you can get service connected through obesity. And I'll talk a little bit about that. So, what this veteran said is that his service connected physical conditions caused him to become obese, and then that obesity caused sleep apnea. And you can get service connected for that. And we've seen it, we've worked on them, we understand the memorandum, and that's how we prepare a lot of these opinions. So for this veteran, he was 50% service connected for depression, 10% for his left knee, and 10% for his right knee, and 20% for his left ankle. And in this denial, okay, the examiner went through here, and 11 times they said that obesity is primarily due to consuming more calories than the body burns off, which is a choice. Therefore, his sleep disorder and left ankle are not medically related. Okay, so they took the sleep disorder and the left ankle and said, no, it's because you're eating more calories than the body burns off, and that's your choice. So then the next time they say, no, obesity is primarily due to consuming more calories than the body burns off, which is a choice. So your sleep disorder is not related to your irritable bowel syndrome. And they go on and they say individually that the depression isn't causing the sleep apnea because sleep apnea is caused out by obesity, and obesity is a choice. So 11 times in their medical opinions, they say this. Ridiculous. Ridiculous. So when you write an opinion or you get an opinion for obesity as an intermediate step, you have to state that the veteran's conditions caused them to be obese and that obesity was a substantial factor in the development of sleep apnea or whatever condition you're claiming. And then the medical examiner has to determine if they were not obese, would they still have developed the sleep apnea or the condition that they're claiming? So for this veteran, we stated the veteran's left knee, left ankle, and major depression caused the veteran to become obese. Obesity is a substantial factor in the development of this veteran's obstructive sleep apnea. The veteran would not have developed obstructive sleep apnea if the veteran was not obese. So he was service connected for multiple things that prevented him from being physically active. And his depression was specifically stated that he had difficulties with motivation and with mood. And when you're trying to maintain your weight or trying to lose weight, you have to be motivated. You have to be focused and able to address anything that you consume and the exercise and the pain. You have to be able to juggle all these things. And this veteran did not demonstrate that he was capable of doing those things. So in our letter, after we explain about how his physical ailments limited him and his mental health condition prevented his motivation, at the bottom, we kind of argue with them and we say, kind of argue, I guess. It says, one phrase seen 11 times in the Nexus report states that obesity is primarily due to consuming more calories than the body burns off, which is a choice. However, this phrase is not supported by medical literature, and it wasn't. It's not supported by medical literature citations, and I'm unable to find medical literature to support the repeated phrase from the contract examiner. One piece of medical literature found states that many healthcare providers and patients share the belief that obesity is a product of poor lifestyle choices that are under the voluntary control of affected individuals. So I take that literature and I talk about how the veteran basically needs to have all of his ducks in a row. And guess what? If a veteran doesn't have his ducks in a row and he's filing for service connection, that's his prerogative. You know, he didn't ask for this mental health issue. He didn't sign up to say, well, I'm going to walk away from here being depressed and having issues after I leave service. So I just found it fascinating that the mindset, and this is from 2022, this decision was. So I just find it fascinating that the mindset is that, well, you're overweight and it's your fault. So, and no consideration of the other ailments that this individual had. So
Was that
if you have
individual
something like that.
diabetic by chance?
No, they had no their only risk factors were their physical ailments. So and their I was trying to see normally we put the BMI in here, but I'm not finding it real quick. So they did not have diabetes. He might develop it later,
Yet,
and then he can get
yet.
service connection for that.
He can. And then they'll make them go. They'll
Well,
make them
that was the
attend the
point I was
Olympic
going. The
Olympics.
question that I was going to statement next. American Diabetes Association declares that obesity is caused due to the fact that the body does not accept the insulin to which it produces, and in some cases does not accept the insulin, which is my case is injected, or in your two cases it's done by the pump, and therefore you become obese and continue to grow. And which is the reason for that. That's how come now we have Ozempic, which works. Um,
Yes.
and that offsets the problem that the three of us had with our diabetes and bad insulin or body not accepting our insulin, um, which causes obesity, which causes a sleep apnea, and everything is secondary. It might be the third secondary down the road, but it's still secondary.
Yeah. Yep. Any
Yep.
questions about
Just
that
don't
one? I
blame.
think I'm going to switch topics.
Yeah, let's switch over. But that poor guy. I mean, it's some of these doctors say this. I mean, they're supposed to attend some type of training to understand this. And you cannot interject your personal, political, or whatever views into doing your job. You need to be able to follow the rules. As a quality assurance
Yeah.
expert, I would kick that out in a hurry, because you have to go by what's listed in documentation. You can't just up and make your own.
Yep.
So, okay.
So since you talked about that, let's talk about, let's see. There's one on diverticulitis that I want to talk about.
Hmm.
Um, let's see. Okay, let's talk about this one. So this one is a rating decision from September of 2024. And this veteran was seeking service connection for his neck condition. Okay. He served 15 years in the Army as a helicopter pilot. Okay. So his rating decision says, so he submitted a private opinion by his orthopedic physician. And it says the January 18th, 2024 medical opinion from Dr. So-and-so indicated that your degenerative disc disease of the neck originated from service in relation to parachuting, rappelling, and an aircraft crash, and over 2,200 hours flying with heavy equipment worn and constant aircraft vibration. To me, that's logical. That is pretty physically intensive, and doing that for 15 years, you're tearing your body up. Okay. The rating decision goes on to say, this is according because we wrote a Nexus letter, and it says that our Valor for Vets medical expert stated that the veteran endorsed neck and back pain that continued and worsened after service. He continued to fly medical help. Oh, sorry. The examiner stated that you endorsed neck and back pain that continued and worsened after service, continue to fly medical helicopters, and have 2 or 3 flare-ups per year. So what we were doing was just restating the veteran's testimony in that aspect. So they use that as a reason to deny because, here we go, while the private medical opinions and medical literature support events that show causation of a cervical spine degeneration, the medical evidence during and following service do not support the conclusion that a chronic condition was present during or after service. The medical opinions lack probative value as they do not address the sudden onset of symptoms in March of 2022 or the impact of flight activities following service. So after this veteran got out of the military, he decided to go on and fly medical helicopters. And in 2022, he woke up and he had severe pain in one of his arms. Okay. And this rating decision goes through and quotes medical records from October, from March, from December. And what it talks about is how this veteran would lift weights, or how this veteran suddenly developed this arm pain. And come to find out, there was no medical opinion sought for this. This is the rater copying and pasting the notes from the medical visits and saying, well, there's not a nexus there because you have all these other conditions and all these other treatment records that weren't discussed. And so then therefore it's not service connected. So specifically, it says the medical opinions lack probative value because they do not address the sudden onset of symptoms in March of 22 or the impact of flight activities following service. So this is a rater providing their own medical opinion to deny the veteran. And
You don't have a
for
right to
this,
practice medicine.
no. And when originally when we saw this claim, I told the veteran that because what happens is when we write a nexus letter, we will go on and say, we'll write a rebuttal if you're denied for medical reasons. So for me, this was not a medical reason. This is a legal issue because you have a non-medical person, you have a lay person creating their own medical opinion, and it has no legal value. You can't, that means nothing from a legal aspect. So we weren't going to write the rebuttal. And I said, go talk to a representative, let us know what they say. So a couple months goes by and he comes back and he says, hey, I talked to my representative. They still want a nexus letter to kind of refute the rating decision. And so we did, based off of the representative's request. So in our rebuttal, I talk about the veterans, all of his service connections. So during military service, he participated in cadet boxing, during which he sustained multiple head and facial traumas. He is currently service connected for a deviated septum attributed to facial trauma. So if you have facial trauma, you're also getting the impact on your neck. So you're having the rebound and the trauma from your neck. And then I talk about how he served as a helicopter pilot, logging over 2,200 hours of flight time. In 2004, he sustained injuries during a helicopter crash while attending flight school. So they were up in their helicopter and something happened and they got lucky in the fact that when they dropped, they hit a tree and they sat in the tree. But he ended up breaking his tailbone and he had a TBI. Okay. So he's 0% service connected for the TBI because of head trauma. Head trauma, again, you're impacting the cervical spine. And then I talk about how he's service connected for a tailbone injury related to the crash. So this crash was a significant trauma to the body in general. And so this veteran's story is because of the tailbone injury. He had trouble sitting and he really struggled and manipulated his body so that he could continue to fly. And all those stressors, impact the rest of the spine. So then I go on because they said that we didn't talk about how he flies medical helicopters. I said, following his military service, the veteran has not experienced a traumatic brain injury. He has not experienced head trauma, and he has not been involved in a helicopter crash because they want us to talk about his post-service stuff. Well, he didn't have a helicopter crash after service. He had it in service. So the impact is much different than what we're looking at with his current occupation. And then I talk about how the medical helicopters are less physically demanding compared to his 15 years of military service. I said, contrary to the inference in the rating decision, the veteran did not experience a sudden onset of cervical spine symptoms in March of 2022. Instead, he woke with nerve symptoms affecting the upper extremities. The sudden development of nerve symptoms during sleep is commonly observed in individuals with degenerative disc disease. And then I talk about his MRI, which also supported that it wasn't a sudden onset. The prolonged nerve pressure caused by sleeping position in the presence of cervical disc disease can exacerbate the condition. The March 2022 report of nerve symptoms is clinically consistent with an exacerbation of the veteran's cervical spine condition. So they're trying to argue that, oh, you didn't have an issue until you woke up and had numbness in your arm. No, that's why you're not medical. That's why you're not qualified to write an opinion. Well, 15 years as a helicopter pilot, cadet boxing, rappelling, parachuting, and then you get out and like 8 years after discharge, you all of a sudden wake up suddenly with issues. I just, on this one, the takeaway from this is you need to understand when you need legal representation, medical representation, or medical help. In this case, when a lay person provides a medical opinion and they're not quoting a medical examiner, they're not issuing, at least as likely as not, then you need to argue that from a legal perspective. Yes, you can get the help of a nexus, but you also need somebody. If you're willing to take that on by yourself, I don't know that I would recommend that. I think you need an advocate in those cases, but um, yeah, that's the takeaway. So the next one I want to talk about, I know we've got like 18 minutes left, so some of these I might just dance around. This one here that I want to talk about briefly is the diverticulitis one. This rating decision, the first rating decision is March of 2024, and the second one is June of 2024. And this is a veteran who had multiple dates of service, and it was almost consecutive. For like 10 years, there was only a 6-month period that he was not active. The rest of those 10 years, he was on active orders. And so he has multiple DD-214s. And in the first rating decision, they missed 2 of the DD-214 service dates. Okay. Then on the second rating decision, they missed 1 period of service. And the 1 period of service they missed was that period that the veteran was seen for his claimed condition. Almost seems intentional. So they excluded November 2009 to January 18th of 2010. He was seen for his claimed condition on January 16th, 2010. He was in the emergency room seeking treatment for abdominal pain for diverticulitis. He was on active orders, and for those 10 years, he was only ever off active orders for 6 months. So when they denied his service connection, they're saying that there was no treatment for the condition in his service treatment records. Your service treatment records do not contain complaints, treatment, or diagnosis for diverticulitis or diverticulosis. So when we write our nexus, we're saying, hey, on your rating decision, you forgot a period of service. And during that period of service, he was seen for diverticulitis. A CT scan was done, and he was given medication for treatment of the condition. So in this case, he probably didn't need a nexus letter. He probably needed someone to say, "Hey, VA, you missed this period of service, and by the way, during that period of service, I was also treated for the condition." So, from the medical examiner side of thing, we're not confirming the dates typically, okay? In this case, it was because that he received treatment that I was like, "Wait a minute. Why isn't this date in here?" So, as the veteran, you need to make sure that the VA is recognizing all periods of service that you have DD 214s for. The information that is in that paragraph is the information that is given to the C&P examiner. So, if they're missing a period of service, that C&P examiner isn't getting that period of service either. Any questions on that one?
Well, no questions, but it seems to me it's obvious. We have still, to the best of my knowledge, we're still doing a 94.6% denials. So it's obvious they're looking for reasons to deny it, or making up reasons for denying it, or overlooking information, like in this case, that they would not have been able to overlook, just so that they can continue with the denial and say, "I'm going to let somebody else make this decision, not here in the regional office, not on my watch." And I think that's the thing we've been seeing going on for numerous years. And I don't think there's any end in sight to that. I think we've got to do just exactly what you're saying. As a veteran, unfortunately, it is our responsibility as a veteran to make sure that they have all the information they need. And when you get a denial, make sure that they looked at all the information that is in your medical records. And you can do that by getting someone like you, or some of the other agents around the country, to be able to help you with that. And if you're, if you're not, you got to be pretty savvy, or learn to get pretty savvy, in order to beat the VA at their own game. And the best compliment I had was just a few months ago, when a patient advocate says, "Boy, you really know your way around the VA." You bet I do. And so, and I told him, I said, "You bet I do. And I also know the law." And that's one thing that a lot of times you guys don't follow. You don't follow the law.
Yes,
And so,
absolutely.
you know, there's some things, guys out there, I hate to say this, you just can't do dealing with the VA like you do any other organization or any other group. You have got to be involved yourself. You got to take and make the effort, you or your spouse or a loved one, such as a son or daughter, has got to take the responsibility to help guide you through this, and look up all the information and make sure that they follow the law. Because there's not, if they break the law, there's no deputy sheriff's going to come and get them.
Yep.
You got to go get them. You got to be the deputy sheriff. You got to be the prosecutor. You got to be the judge. And so you got to take the time to do that. What you pointed out tonight, to me, is an excellent examples, every one of them, how these denials should not have ever been denied to start with. And it's because of a slip up, not necessarily because of the veteran, but because of the
Yes.
VA regional office.
Yep.
So,
Now, the other big
so
takeaway, like I want for listeners to have for tonight, is if you get a denial, whatever reason they give, don't feel like you're being singled out. Don't feel like you're special, because they hand it out so much and it's absolutely ridiculous. And I think the most ridiculous one that I've seen is going to be our last one that I'm going to talk about here. I shared it with John earlier, and some of it really, if you're an empathetic person and you care about people, some of these can really just devastate you and make you sick. So so don't feel special out there if you got a
guys, you got to
denial
be
letter.
bad. If you know you got this condition, if this condition happened while you were in the military, then stand up and fight and continue to fight till you win your case. And, it took me 11 years to win my first one. And I still didn't fight. I mean, I was told numerous times, well, how is it that you say it, John? Don't poke the bear. I was told, well, you've got 100%. Why do you want more? Because I deserve it. Because the law says I'm entitled to it, and that's it. If you're entitled to it, get it. If you're not entitled to it, if you don't have those conditions, then don't pursue it.
Hmm. All right, are we ready for the last one here? All right. So I think what I want to do on this one is I want to talk about this veteran's history first before we get to the denial. Okay. So this is a case from 2016, 2018, we got involved. And so the service history is the veteran served in the Army from October 1999 to March of 2004, and then again from February 2008 to January of 2014. So we have 10 years in there, or maybe a little bit more. So the veteran served in combat and was diagnosed with depression, overdose, alcohol use, and PTSD while on active service. He was being treated for substance abuse associated with his mental health disorders while on active duty. In September 2012, while he's on active duty, for the depression, overdose, alcohol use, PTSD, his medical discharge summary states that he was going to be evaluated for possible suicide by psychiatry. However, this was unable to be done. So the military did a disservice, I think, there. At his follow-up for his hospitalization, the clinician documented that the veteran's recollection of events prior to the suicide attempt. The records document that the veteran went through his Army things and began to have a panic attack, triggered by memories of combat. So from that point on, the veteran does not recall the events that followed, which led to his mental breakdown. So he's having psychotic issues, okay? So he has a neuropsychiatric evaluation, and while he's in service, the records show that he has had extreme emotional turmoil. And I quote, extreme emotional turmoil that complicate his current clinical picture. So they can't figure out, I think what it came down to is he had a TBI and they couldn't really figure out if it was TBI or if it was his mental health issue. But they finally decided that it was because of his mental health that he's having all this memory loss and psychotic issues and substance abuse. So he was service connected for a back condition with radiculopathy, and he was treated by the pain clinic. And he was prescribed Percocet by the pain clinic, okay, for his back pain. In March of 2014, so this is 2 months after he was discharged, a clinician documented that they were concerned with his history of mental illness and alcohol abuse, and I outrightly told him he is at higher risk for abuse of opioids, so we have to tightly monitor usage. In his compensation and pension exam, the examiner documented that he had active suicidal ideation, thoughts of hurting himself, and he demonstrated avoidance of external reminders and distressing memories. So when a person starts to demonstrate those activities, they're starting to drink alcohol or use drugs because they're trying to avoid those memories and trying to do what they can to just kind of forget that whole time. Okay. So in the ratings decision, the rating decision denied the widow's application for benefits. I didn't mention this, sorry. He died from acute fentanyl intoxication. And let me see the date on that. That's the most important part. The veteran died on March 14th, 2016 from acute fentanyl intoxication. That was the very next sentence. I didn't read it. So Yeah, so he's less than 2 years out of service. He's got all these mental health issues. There's concerns for him using these opioids because of his history of alcohol abuse. And so he dies from acute fentanyl intoxication. And that's what is on his death certificate is acute fentanyl intoxication. So the VA denied the widow's benefits for cause of death. And this is what it says. The death certificate shows that the veteran died on March 14, 2016, and the cause of death was recorded as acute fentanyl intoxication. The U.S. National Institute of Health, U.S. National Library of Medicine website provides an important warning for fentanyl. Fentanyl should only be prescribed by doctors who are experienced in treating pain in cancer patients. Fentanyl should be used only to treat breakthrough cancer pain. There is no medical evidence of record that the veteran was being treated for any cancer. And that is why they denied the widow's benefits. And that was not a medical opinion. That was a raider copying and pasting from a website. What? That is sad.
What can you say?
So when we wrote this nexus, we obviously outlined what I read to you, his history. And we talked about how um, with the suicidal ideation and avoidance, like he was introduced to opioids by the pain clinic in active service because of his physical conditions. So his introduction to opioids, which fentanyl is an opioid, it was done by the military. So if he has access or he can get opioids and he's trying to self-medicate, that happens with mental health disorders, especially severe. And he had everything. And they decided that, well, he doesn't have cancer, so he shouldn't have been taking fentanyl. Yeah.
Bethany, have these denials have they been appealed? And if
So
so, were they appealed? How they were they appealed? Did they go to the board, or did they just ask for a higher level or supplemental claim?
So we don't get a lot of the process if the veteran comes to us directly. The opioid case came to us through an attorney because they obviously were representing the widow and needed that opinion there. Um, the case on the diverticulosis, that came to us directly from the veteran, and he's going to appeal that with our medical opinion. That was a recent one, so we don't have any details on that one. Same with the helicopter pilot. We suggested he get legal representation, and so he's working with a legal representative with a nexus from us. And then the sleep apnea one, this one was sent to the board, and knowing this attorney, it was one. Otherwise, I would have heard from him. And then this last one, or the first one that we talked about when it comes to sleep apnea, and it talked about all these risk factors he didn't have. He won with the Nexus letter from us, and he didn't have representation on that.
Key thing to remember right there that you just pointed out. Every one of those cases either did or are continuing to fight for their disabilities that they deserve. And
And
that's the
there,
most important things. Don't give up. Go wherever you need to go to get the proper representation, but get it done.
and they were all to fight those. They should have every single person, every single veteran, every single case that I talked about tonight, and I've got more over here that we didn't get to. They should have fought it. It's ridiculous. The nonsense that the VA has and the audacity to tell the widow that because your husband didn't have cancer, that he's not service connected for that. I mean, he had kids.
The last one, widows, that wasn't, I don't know if you can say this or not, but that didn't by chance happen in Detroit, Michigan, did it?
No, but I can tell you where it did happen. And I want to say Philadelphia. Philadelphia VA Regional Office.
Okay.
Right, you got to close us out.
Oh, okay. Folks, thanks for joining us. Bethany, thanks for coming on tonight. Great job. I really enjoyed hearing all of this. And for those of you who are listening, I think the most important thing that you can get out of this story is the cut and paste. They don't, some of these guys don't even know what they're cutting and pasting. They just do it because they've seen where it worked before. So read it very carefully. Make sure they're really talking about your case and your situation. But until next week on Bethany, thanks for being with us. And on behalf
Thank you.
of John Stacy, this is Ray Cobb saying good night, and we'll see you next week.
Bye.
Bye bye.